All righty. Dr. Shaw
Squeaky
is here.
wheel.
It's been a year. I finally have your name down. Dr. Koushik.
Hey.
Koushik.
Hey, Dr. Shaw.
Koushik. What's up, brother?
Good morning, guys. Good morning.
Closer to the mic. Closer to the mic.
I made it.
Is this the first one of the year? Is this the first?
Yeah, first one this year.
First men's health segment we've done this year.
This is the first men's health.
This
Hey,
year is going by.
I'm coming to see you. I think I'm gonna do. I want to try the testosterone thing. I tried the sublingual tablets, and they didn't really do anything for me. I'd like to try the underarm cream or something. Is that what you do? But is that risky with the kids?
As long as you're not nuzzling them under your arm, the armpit, sometimes that happens.
But if I did, could that turn my daughter into a lesbian?
Might grab grow out a mustache or something like that, or a
That's what I
goatee,
want.
but that's okay.
I don't want her to spend a bunch of money on clothes.
You want her to get more hair.
Yeah, isn't that what we're talking about today? Testosterone?
So the whole low testosterone thing is probably one of the biggest growing parts of our practice right now.
Could you do me a favor? Could you hide the Mercedes key? It's really making me feel guilty about my career. Just a joke. So go ahead.
So the deal is that guys, as we're getting older, we want to stay there's this whole I want to stay young forever. And there's guys who are getting remarried in their 50s, 60s, 70s, and they've got girlfriends, and they don't want to give up all parts of their lives. They want to work out, they want to exercise, they want to be sexually active, all of those things. So the low testosterone issue has really kind of come to the forefront now.
Yeah, but is it for real? Because it's advertised so much now that you wonder, is it a real deal?
Well, so there's also a natural issue with declining testosterone as we get older. So as we get older, say over the age of about 40 or so, our testosterone decreases about 1 to 2% per year. So, and that's the thing, our grandpas, when they were 60, they were ready to kick the bucket. They were already in a rocking chair drinking lemonade, and now they're like, hey, that's not what it is.
But isn't that nature's way of telling you need to lay down in a box?
Yeah. It is, but we don't want to do that.
But is it healthy? Is it healthy to jack with it? Because I know Bob and I. Did you go over there and do it or not?
Yeah.
No. What are you doing? The cream? Is that why you're wearing?
That's between me and my doctor.
Is that why you're? Oh man, you should have given him.
It's a gel.
You didn't need it.
Where do you rub it into?
Huh?
Where do you rub it into?
That's between me and my doctor.
I'm coming next week.
So the deal with testosterone,
inner thighs.
Yeah. So the deal with testosterone is you can't take a pill for testosterone, and the reason being is it goes through the liver and can have toxic effects that way. So one of the things where you hear about athletes, et cetera, they're always injecting steroids.
So wait a minute, I did it the wrong way when I was doing the sublingual.
No, that's another route to get it in there because it's going sublingual is a
There's blood vessels in there.
It bypasses
blood
the liver
vessels and membranes in there.
Yeah.
All right.
So blood vessels and membranes. So the deal is you always hear about athletes injecting, and the reason being is that it bypasses the liver when you do it that way. So, but when it comes to testosterone supplementation, there's really, at least for right now, there's 3 types of gels. One is on the upper extremities, up on the upper chest area. There's a second one, which is a gel under the arm that you talked about, and a third one is on the upper thighs. So, and they're basically like hand sanitizer gels. So they're just, you take a shower in the morning, you put this gel on, it dries, within about 30 seconds or so. Put your clothes on, you're good to go for the day. So the gels are the way to go. There was, believe it or not, guys, a scrotal patch.
Oh wow!
But that didn't make it for very long.
Boy, I can't imagine what that's like peeling that off.
It's not fun. You had to shave down there and slap a patch on your
No.
But no, so there's 3 different types of gels, and there is such an interest in it right now just because of guys with feeling tired all the time, feeling depressed.
That's me. Okay,
decreased libido and things like that.
Talk to me about this real quickly because I really am making an appointment with you, and that's why I'm coming in. I just seem to be, I don't know, I just seem to be lethargic. I don't get a lot of sleep. I don't get the perfect amount of sleep, but I mean, I've just found out my kneecaps are worn out. And I got a couple of discs that are bulging in my back, and I just feel sore all the time. Now, I know it's not going to fix that, but it's definitely, maybe it'll help me with the motivation to work out a little bit more or less tired. Will it help there?
Low testosterone will fix your kneecaps, it's been found. I'm kidding.
Oh, God. You had me.
But that brings up a good point. A lot of guys come in and say, Doc, I'm tired. I have decreased libido. My wife and I, the relationship isn't there. And sometimes you just realize, you know what, you and your wife don't get along. Sometimes work sucks. Sometimes you're not getting any sleep. Sometimes you're a truck driver 20 hours a day, and it's your life. And this gel is not going to make your life butterflies and roses. So you have to kind of parse, hey, what's life and what's going on with you. and what's the, and so what we do is when our patients come in, we talk to them about all the lifestyle issues. We'll check their thyroid, other things that cause low testosterone symptoms. So we check the thyroid levels, we check B12 levels, we make sure that you're not anemic, that you have a decreased red blood cell count. So we kind of check for everything else as well as this.
I just found out I had the lowest vitamin D count that they've ever seen in Texas Orthopedics. Well, second lowest. Now, would that keep me from getting the
No,
testosterone?
Not at all.
I had a 9 on the scale or whatever. That's low.
You need like a sunroof or something in the studios here. There's
No.
not enough sun in here.
That's right.
I get plenty of light from the computer screen. Okay, so let me ask you: are there any studies long term that this is a healthy thing to do?
So what they found is actually is that low testosterone has a lot of bad side effects. I'll put it that way. Meaning to say it can lead to central obesity, so the spare tire.
Right.
It can increase the propensity to diabetes.
Right. Depression, right?
Yeah, depression. It can, we talk about cognitive skills, ability to do crossword puzzles and things like that at age 80. Low testosterone versus normal testosterone. So point is that there's a lot of osteoporosis. We're talking about bones and things like that. So there's a lot of bad side effects to lower than normal testosterone. So there is an element that we're kind of screwing with the natural process of declining testosterone with age, but that's where society
So
is
could I
going.
slow down? Could I slow down the arthritis in my back a little bit, the bone spurs, by upping my testosterone possibly?
Well, I'll put it this way, in a roundabout way, if increased testosterone means that I can exercise more, that I can drop some weight on,
and you
on
do
my body.
that was my
which
other
is
question.
Better on my joints,
Right.
Yeah,
I'm coming in. All right, we'll move on. And I'm trying to make this about me. I'm trying. Everybody out there that's over the age of 40 can relate to some of these issues that we have, whether it's knees or bones or working out or being tired. I think everyone's being tired.
Yeah. And let me ask you too. I don't know if you have something at your office for this, but I'm over 40 now, and I've never looked better or felt better.
I was going to
my life is pretty awesome. My marriage is great, and so is my career. Do you guys have like trophies or anything over there you'd hand out?
Your testosterone may be too high. This
I don't know. It's just been good for me.
Sounds like his ego
this,
is overrunning its body.
We mostly sell. You say you have a lot of people when they come in for their vasectomy. They do mention the radio show. Right? Is that still happening?
It does. And one other last thing I was going to tell you about low testosterone, whether you see me or any other medical doctor, I was going to give this one point that because that field has kind of really taken off so much, there's a lot of fly-by-night clinics that have opened up. And one of my patients who came to us after hearing about it used to see like a retired OBGYN. So point is, go see a proper medical doctor. Come see us if that's the case. But make sure you don't go to one of these fly-by-night places.
I'm seeing stuff on TV
it's just
that
becoming
looks
a thing now.
That looks like herbal testosterone too. They're trying to like pills and things.
And by the way, Dr. Shaw's Austin Urology Institute.com. I was going to all the stuff since our vasectomies. I know we're not doing vasectomies today, but the libido thing is the opposite of what I read online. My libido, I don't want to gross the listeners out. Some of them are eating breakfast. My libido is so ridiculously past what it was pre-vasectomy. It's nuts. I don't know if it has anything
Unintended.
to do. No, right. But there's it's way like crazy.
I love it
for my age, especially.
I love it.
The other thing we're going to talk about today, and we found out we have a victim, somebody here in the building who has a horrible problem with this. I guess I shouldn't say his name unless he wants it on the air.
Probably not.
He was thinking about coming in, but kidney stones are a big problem here in Central Texas. And you deal with that.
We do. And in fact, there was an article that we posted the other day about Vince Neal. Who had a kidney stone, and it basically forced him to cancel his concert. Just brought him down to his knees. So the deal is with kidney stones is we don't form them in one day or 1 week, but what happens is we're about to enter the hot part of the year here in Central Texas, 100-degree days. We get dehydrated. We drink Dr. Peppers and Cokes and stuff like that, things that kind of actually cause the urine to become more acidic and more concentrated, and we can start forming stones. And a lot of people also have a family history of kidney stones in their fathers, sisters, brothers, and things like that. So, I mean, you could get a small stone, 2 to 3 millimeters smaller than an M&M, block your kidney, and it will make a grown man.
So the local water is not so much the issue then, really. Water would be more preferable to the other drinks that you were talking about.
Yeah, 6 to 8 glasses of fluid a day. Drinking lemonade or lemon in your water is actually a good thing. It's like WD-40, keeps the calcium molecules from sticking together. But I have patients that basically live on Red Bulls and Dr. Peppers all day, and I tell them you can't do that stuff, and they look at me like, "What am I supposed to drink? Water?"
Is there any kind of?
It's like, yeah, you're supposed to drink some water.
Is there any kind of preventative screen for kidney stones, or is there a way to know you have them before you go through that thing where you're all of a sudden you're doubled over and you're in a hospital?
Yeah, so if you've had a prior history of kidney stones, that's a great point. If you had a prior history, I had them before, I've been in the ER, I've had surgery, or I've got a strong family history. What we do is either an ultrasound or an X-ray of the kidneys just to make sure that there's no current stone, so we can do that. And number two is we actually do a 24-hour urine study, so we actually have you pee.
The guy here who gets them has had 7 episodes, and I always thought it would be like my wife had the ureter problem in her kidneys. I always thought it'd be like that back pain. He said, no, it feels like you're being kicked in the nuts for 24 hours straight.
Yeah.
I mean, for more than 24 hours. He said it's unrelenting.
That or you're just getting stabbed in the back, and it'll wake you up at 3:02 in the morning. And
my brother had one. I don't ever get one, man.
Yeah. So this guy.
So if are you asking people to come in if they have a family history?
Not necessarily. Well, if they have a family history, that's something you should be aware of. And you can go to AustinUrologyInstitute.com, and we have a lot of information on stone prevention. So just read that. But if you've had a history of this guy with 7 stones, and he's been in and out
he should be here in a minute. I don't want to name him, but he should be here soon. He should come see you.
Those are folks that should come in, get seen, because the best thing is to do is prevention. Like, come in during the day. Don't come up at 3 o'clock in the morning in the ER and make a mess of it for yourself.
But they don't have a thing like they do with gallstones that can sonically break them apart or anything like that?
We do.
Oh, you do?
Yeah, so the cool thing is if you can catch these things ahead of time, it's called shockwave lithotripsy. You can be on a machine. It's sort of like a video game. We'll target where that stone is, send shockwaves through the skin into the stone, break it up, pulverize it. You pass out the sandy debris.
Well, there's a couple of calls before you go here. This went quick today. John, how are you?
Doing good. How you doing?
What's your question?
I heard that the injections were actually better than the cream. Is that true? And does your practice off that?
So the deal with testosterone is that usually there's something called not enough, in the middle, and then too much. So in our practice, what we tend to do is try to find a testosterone level that's around the 600 range. So whereas the normal range may be 200 to 1,000. So we get 600 to 700 range. I like the gels. I like the creams. And some other options that we have, which cause the testosterone to increase every morning. That's why you get the morning wood, decrease in the afternoon. So up and down every single day. The issue with the injectables is that, at least for right now, there's newer ones coming out, is it's like you're sticking your finger into a socket once every week or 2 weeks. And that's going to cause your testosterone levels to go way past 1,000, and then you're going to drop before your next shot. So it's way up and down.
And you break out.
You're not following your normal circadian rhythms.
Exactly.
You break out of your clothes and turn green.
And the problem with those super high levels is that can cause emotional instability sometimes. So
like things like
we call it steroid rage.
Yeah, we already got that box checked, dude.
Corey, what do you got?
Hey guys, thanks for taking my call. Hey Doc.
Hey, good morning.
Hey, so I'm 34, and actually a lot of the stuff you were saying kind of registers with me.
Good for you.
I kind of feel like I'm going through many of those symptoms, and so at 34, I'm wondering, is there a way to naturally increase my testosterone, and then possibly later on, as a last resort, come to see you? Do you have any advice on that?
Are there foods? Or are there dietary things?
And you're one of the few guys that says that. Most people say, just give me some meds and let me medicate my way out of this. So for a lot of guys, I tell them one of the easiest things you can do is exercise more. And every bit of fat that you have on your body, actually there's a thing called aromatase in that fat, and it takes your testosterone in your body and converts it to estrogen. And that's where I tell guys that's where you get the man boobs.
Oh.
And so the more fat you have on board, in a way, look at this as I've got more estrogen on board. So, I say exercise
so I'm
to
basically
get to your lean weight.
You're trying to say I'm a woman.
You're a nice A cup. You're a nice A cup. I didn't want to stare.
A cup. Oh my God.
Hey, what do you think about have you read Wheat Belly yet? What do you think about the connection of wheat and all the different diseases and stuff? Do you think there's anything to that?
I haven't read that particular book, but I know for myself, I drop my carbohydrates.
Yeah, me
big
too,
time,
man.
And I
feel
tell that
so
to
much
my
better.
patients a lot, big time.
I mean, I'm tired and stuff, but I find I have less of the rashes and less of I don't have the cravings to snack all the time are gone.
Yeah.
When I drop my carbs.
There is a ton of sugar in our diets. I mean, it's incredible. And since dropping that, I dropped about 10% of my own body weight. So
all right,
I highly recommend
one more, and then I got to call and make an appointment over there. What's the number? Give me the number. I know I have it in memory, but
694-8888.
Yeah, and it's Austin Urology Institute. And do this for vasectomies. He'll do it on a Thursday, Friday, sometimes on Saturday, right?
Yeah.
And you're back at work on Monday. And it absolutely is nothing. It's really nothing. It's nothing at all. The buildup is the worst part of it all.
Right.
Okay. Why did
you get a little pill?
Because it's your balls.
Out.
Micah, last phone call. What's up?
Hey, guys. The show rocks. You guys rock. I had a question for Dr. Shaw.
Sure.
I'm 28 years old, and I've never had a prostate check. When is the appropriate age to start getting your prostate checked?
Usually age 40 to 50 and above. So
or after beer 7.
And especially if you have a prostate cancer history, that your father or your grandfather. But we usually kind of do a baseline at either age 40 or 50, just depending on risk factors.
So you're okay right now.
That. Yeah, you're in the clear.
I had a colonoscopy. I'm going to say it's 8 years ago. I'm 50. I'll be 52 in August. Should I do another one?
The colonoscopy, that's looking for colon cancer, things like that, different from the prostate exam. So that'll be either every 5 to 7 years.
So I probably should do that.
Yeah, so you'll be.
I'm supposed to go in. I haven't scheduled.
I'm trying to think of the last. Now, when I come in for the testosterone, are you going to make me go through all that rigmarole?
We'll do the lab tests. We'll do a basic exam.
Basic exam, but are you going to? Is the basic exam? Is that hand going somewhere?
For testosterone, do you want it?
Well, no, he said basic. No. Basic exam. Is that an add-on?
We're going to be better friends.
No. You do that when I come in.
We want to make sure. We want to make sure you don't have prostate cancer before we give you more testosterone.
Well, I'm looking forward to seeing. I'm looking forward to seeing you next week. Then.
All right, buddy.
I'm gonna come in. I swear, I'm gonna wear like a pair of my wife's panties and some pantyhose. I'm gonna wear a little sign that says "Hi, Dr. Shaw" on my lower back, like a tattoo. I'm joking. We're joking.
I've seen a lot. I would pay to see that.
I am coming in to see you next week. I'm making an appointment today. I told Amanda yesterday I'm making an appointment. Always good to see you. We love this segment. We'll do it again in a couple of months.
Okay.
And we'll talk about something else, and we'll say it again. And I'm way late, and I don't care. Guys, you have to pay attention to this stuff, because that's the way people end up dying, is they don't, not necessarily testosterone and kidney stones, but if you don't be aware of your body and occasionally get it checked out, you always see guys that come in too late.
Right. And guys in general don't come to the doctor unless something's falling apart. And I tell you, there's so many guys that listen to this show. They say, thanks for coming out to do this, because I wouldn't be in to see my doctor if I didn't. Otherwise, if you guys didn't come and talk about it.
AustinUrologyInstitute.com 467. Well, I can't do numbers today.
694-8888.
I couldn't even remember the request line number last night. 694-8888. Dr. Shaw, thank you, sir.
Thanks, guys.
All right, we'll see you next time.